Welcome to our webinar on when exercise is a four-letter word, physical therapies for fibro. I'm Nicole at Swing Care, and I'm so excited to welcome Dr. Corrie Maguire and Dr. Andrea Chadwick today to talk about why the physical aspect of fibromyalgia is so important and what treatments are available. Just to give a little bit of background on our guest today, Dr. Corrie Maguire received her BS in kinesiology and minor in social sciences from the University of North Texas and continued to pursue her doctorate of physical therapy at the UNT Health Science Center in Fort Worth, Texas. She is passionate about bringing awareness to the many unrecognized pelvic health issues people often suffer from and educating her peers on how to educate patients and providers about the many resources available to help these people heal. And Dr. Andrea Chadwick is Medical Director of Swing Care and double board certified in anesthesiology and pain medicine. Her clinical expertise focuses on complex centralized pain syndromes, including fibromyalgia, and she is the director of the Fibromyalgia and Centralized Pain Exploration Lab at the University of Kansas Medical Center. So welcome to you both. Really excited to have this conversation.
Thank you.
Awesome. Thanks. Great to be here.
And Dr. Maguire, I wanted to kick things off with you because I know your practice focuses on pelvic PT, but also that you see many people with fibromyalgia, and was just wondering, what's the connection?
Yeah, so in pelvic PT in general, we see a lot of patients with chronic pain, whether that's a long history or it's kind of become a more recent thing, which obviously our fibromyalgia population can fall into that quite easily. Also, the longer someone has been in pain, even if it's elsewhere in the body, the pelvic floor tends to respond kind of eventually, is what I educate most of my patients on. So oftentimes their problems aren't necessarily starting in the pelvic floor, but once they kind of start popping up there, that's when they get into our office, where we do take a holistic approach and try to help the whole body with all of its pain, not exclusively the pelvic pain, which our fibromyalgia patients tend to really respond to, which is super rewarding.
Yeah. And Dr. Chadwick, I know, over the last decade, 2 decades, we've made so many breakthroughs in how we understand fibromyalgia and the biological basis for it. I'm just wondering if you can talk a little bit more about central sensitization and some of the related conditions. And, Dr. Maguire is talking about, chronic pain, and just curious about how all of those things are interconnected.
There's definitely a link. So the National Institutes of Health recognizes a set of 10 chronic overlapping pain syndromes. Fibromyalgia is one of them, but also included in that list of diagnoses is migraine headache, endometriosis, chronic pelvic pain, irritable bowel. So the list is quite extensive in terms of all of these different syndromes that tend to co-occur in individuals, and the underlying pathophysiology, which I realize is a big word, but what that means in the medical sense is that the underlying cause or mechanism by which pain is being expressed in individuals with any of these chronic overlapping pain syndromes is known as a concept called central sensitization. We're also referring to it as nociplastic pain now. Essentially, what central sensitization means is that the central nervous system is playing a large role in both perpetuating and maintaining pain throughout the body. And there's many different reasons this can happen. Some patients get central sensitization from a genetic predisposition. We know that's about 50% of the reasons why people can get central sensitization, but other types of environmental or risk factors that are non-genetic can be playing a role in why patients develop central sensitization. And some of those different ones include a history of stress or trauma. It could be certain types of infections, such as chronic Lyme disease, Epstein-Barr virus, or more recently, COVID-19. And there's many other risk factors, such as autoimmune disorders, as well as growing up and being exposed to early life adversity and traumatic events in childhood. But overall, this central sensitization, once it starts occurring, leads to a variety of different changes in the central nervous system in terms of how pain is processed. And so in these individuals, what we see is an amplified response to pain. That's what we call hyperalgesia, meaning that a painful stimulus in a person with central sensitization is recognized by the body and the brain as more painful than maybe that painful stimulus should cause a response. Also known as allodynia is when a person with central sensitization starts having painful responses or the perception of pain to a non-painful stimulus. So it's really important to understand that concept of central sensitization because it plays a role not only in fibromyalgia and our patients who maybe have some of these other chronic overlapping pain syndromes, but it definitely impacts how the interventions we give patients can be tolerated by patients or how they may respond to them. So I know we're going to talk a lot about exercise, meaningful movement, physical therapy, but understanding that the person with a central sensitization syndrome, such as fibromyalgia, chronic pelvic pain, that the brain is just processing pain differently. And that the goal of therapy is to try and improve that process, but also be mindful of it while we are working on improving those skills.
I think that's like the best explanation of central sensitization I've ever heard. I love that.
I might have talked about it before a little bit.
Yeah, you can tell. That's so good.
Yeah. And I'm wondering, does that mean then when we're talking about treating fibromyalgia, we're also talking about treating these other conditions? Because, we talk to so many patients who have multiple, maybe have migraines as well as fibromyalgia. And then, Corrie, Dr. Maguire also spoke about, that connection between pelvic pain as well.
Well, I'll start with that, but I'd love to hear Corey's take on it. A lot of the treatments that work for migraine or irritable bowel or endometriosis or just any condition with underlying central sensitization, a lot of those drug therapies are helpful in many of those different conditions. So we are really addressing the central sensitization component of those chronic pain conditions as opposed to specific directed treatments at the regional parts of the issues. And so my understanding of chronic pelvic pain is, yes, there is a very large central sensitization component, but there can be that downstream effect of myofascial tension and myofascial pain when it comes to pelvic floor issues, and that you can have these peripheral issues occurring along with those central sensitization conditions. So that's when these directed therapies at specific types of central sensitization conditions becomes really important. So I'd love to turn it over to Corrie to talk about how pelvic floor myofascial pain and just other types of peripheral issues can be addressed with physical therapy.
Yeah, I agree 100%. Most of the effective measures, whether that's drug or therapies, tends to be directed more at the condition as a whole. So particularly with pelvic floor, tension and weakness gets blamed for a lot of dysfunction, which is sometimes correct, and sometimes it's a little more nuanced than that. But frankly, more often than not, it's responding to something, which is why it's behaving this way. It's the same with any part of our muscles, right? So if we tend to struggle with a lot of jaw pain from clenching, oftentimes it's not because we have a messed up jaw. It may be, but the average Joe who struggles with that actually has stress, right? Like they're clenching because of stress, posture, maybe their breathing predisposition isn't great. They're getting some stability for their neck from their jaw, which isn't ideal. And so, again, when we kind of zoom out and look at the whole body, for us to help improve the pain, specifically in the pelvic floor, we're almost always starting with the headaches, the backaches, the jaw pain, all the other areas this pain tends to start out. And the major primary approach that's the most effective and the most helpful for the pelvic floor specifically, but also globally, is changing their breathing, which we know has a huge effect on the central nervous system and the central sensitization. So again, we want to treat where they're having pain, but I always tell my patients, if we start here and we stay here, we're just going to kind of keep playing whack-a-mole. Like, we're not going to get to the point where we're resolving the pain and getting it to go away and stay away, which is the long-term goal, both in our office, and then to equip everyone with the tools, breathing, exercise, which we'll get into more as well too, and then dietary, lymphatic resources, all that sort of stuff to kind of keep the pain away. And if we flare, which happens in life, to also be prepared for that as well and how to manage that. But exactly to Andrea's point, like, you have to get to the central sensitization and kind of calm the whole system down for the symptoms to really resolve in any meaningful way.
Well, and I think it's interesting you bring that up because I always, I live in this land of like neuroscience, and we've got a peripheral nervous
Mm-hmm.
system and a central nervous system, but we completely forget about the parasympathetic and the
Yes.
sympathetic nervous system and how they play a role in all of this as well. So you're really kind of, I think, bringing light when you talk about the breathing, because
Mm-hmm.
that's definitely more linked to a parasympathetic sympathetic dysfunction or mismatch compared to what we're
Mm-hmm.
talking about when it comes to central sensitization. So all of those biofeedback, relaxation, diaphragmatic breathing. I mean, I'll tell you what, I know that most days when I'm stressed out, I'm breathing like the shortest breaths you ever did see. And I'm
Yeah.
holding all that tension. I'm not allowing myself to take those deep breaths. So
Mm-hmm.
would you be able to talk a little bit more? Because I know you said you work on
Yeah.
breathing. Are there any other techniques that you use in the physical therapy world to help align or kind of bring homeostasis to the parasympathetic and sympathetic nervous systems?
Yeah, we particularly in pelvic health and with our chronic pain patients, we do a lot of vagus nerve. I hate the word stimulation. It is that, but we're not attaching any kind of vagus nerve stimulator. We're just helping them to kind of connect with their own body. And so I treat a ton, my favorite to treat is the bowel issues that come along with pelvic health. And breathing itself is like by far the most effective. And we have a ton of research really for how effective that can be. And there's other small things you can do to just help you connect with your body and your system. So, alongside the breathing, which as a pelvic health specialist, I always have to talk about diaphragmatic breathing for us always includes also, I only have a female pelvis here, but it applies to our males as well. It also includes pelvic floor relaxation and expansion, not just diaphragmatic breathing. So that's kind of the number one nuance I always add to the breathing for my patients is like, yes, we want to breathe into the diaphragm, but we really want that whole body expansion, which also helps the vagus nerve kind of strumming, you could call it, all the way down to the pelvic floor, which we know the vagus nerve goes all the way down there and affects all those functions as well. Particularly with my patients with bowel dysfunction and pain, this is a game changer. So those really, really help. And then also just like noticing your breathing. You can change little things about your breathing. I'm fine with box breathing. I like that as long as we're doing it well, where we're actually diaphragmatically expanding, not just taking big breaths into the chest and raising the shoulders, but all the way down to the pelvic floor. And then you can do little sensory things like humming is really good for also helping with the vagus nerve stimulation. Singing can be great to kind of help you get with your body. Anything that causes some kind of like vibrations in the area where the vagus nerve passes through. But I teach a lot of my patients just to kind of attend to their pain. Like, what is happening here? What does it mean? If I breathe, does it get better or worse? Just kind of like mindfully connecting to the body and not being so scared of the sensations, which is a completely normal reaction to chronic pain, but kind of learning to listen to the body and what it's trying to tell you and treat those like signals is also a great way to just calm your system, because then we can kind of tell the alarm like, hey, I got it, I'm paying attention to this problem, you don't have to keep going off. So that's a few different ways.
I love
um,
it.
I feel like I could go on forever on that subject. Those are probably where I start with pretty much everyone.
And for those who don't know or might be new to them, can you talk a little bit about the vagus nerve and like where is it, what it does in general?
Yeah, I'm sure we could both say a lot about it. It's a cranial nerve, so it comes straight out of your brain and goes all the way into your body, which is different than other nerves that we tend to think of in the rest of our system, right? Most of them go through the spinal cord and then branch out further down. The vagus nerve is kind of what helps to prime our parasympathetic nervous system, which I always help to educate my patients. The sympathetic and the parasympathetic are kind of like the gas and the brake in a lot of meaningful ways. So the gas is going to help us get there. The parasympathetic helps us not to crash on the way, right? Like it helps us slow down and take a turn or stop at a stoplight or whatever. So they're equally important. And having healthy kind of movement, blood flow, stimulation, activity, you could say, in the vagus nerve and the parasympathetic nervous system helps to decrease the sensitivity to pain, which is kind of like a very high level. I don't know if you want to add anything to that, Dr.
I think those are great. I love that gas and brake. I've also heard like our amazing colleague here at Swing Care, Dr. Ginevra Lipton, always is like, well, we've got sympathetic, which everyone knows is like fight or flight. But the term she uses for parasympathetic, I love. It's rest and digest, which you as a bowel health person can understand that. Yes, that parasympathetic system is so important for resting and just those homeostatic, like controlled functions that our body needs to feel good. But it's like a delicate balance, and it wouldn't be good if we were always rest and digest and never flight or flight and the other way around. So it's all about bringing balance.
And being able to switch from one to the other is so important. Another thing we treat a lot of is sexual health, and particularly for people who are struggling with that. Oftentimes, like you said, sometimes they're almost too parasympathetic, and then oftentimes they're too sympathetic. And that's a physiological function where we really have to be able to switch back and forth. And for so many people, they're struggling with being out of touch with their body, which is a normal response to chronic pain, and they really can't do that. And so it is just kind of teaching how to listen to the body's signals and let them happen without fear. And we know the pain cycle causes fear, and that's a normal response. And so kind of getting in there and changing it is where a therapist can intervene.
I love that we're having this conversation about breath and kind of listening to the body. Because I think, when we're talking about physical therapy, that's not the first thing that we think about. And often, patients will go see a provider and they'll be told to exercise. And that's kind of where the title of this webinar comes from, because I think there's a lot of kind of 4-letter words going off in people's brains when they hear that. When you're, kind of told to exercise without more nuance, and you are experiencing chronic pain every day. And so I'm just would love to hear from both of you on what do we mean when providers say exercise, and how might we kind of improve that experience for patients, or just interpret that differently?
I would love, go ahead and start, but I mean, I have a lot of feelings about this. The word exercise is really just like, it's almost just like fibromyalgia, right? Fibromyalgia is like this word, but it doesn't at all explain like what patients go through, right? Like it's fibro is like fiber, and then myalgia is just like muscle pain, but it actually doesn't even describe like what the cause of fibromyalgia is or the other symptoms that go along with it. So I look at exercise kind of the same way. Exercise is, to me, just like this term, but underneath that umbrella is like this giant expanse of what that actually means, right? So I think when doctors say exercise, they're just meaning like movement of some sort that might get your blood pumping a little bit, but that looks so different for everybody. And just like how fibromyalgia looks different for everybody. So I'd love to hear your thoughts on that as well.
Yeah. So I have a lot of feelings about it as well, because I think in general, we think of the idea of exercise is to be empowering. Like, this is something you can do to help you feel better. But I agree completely that that is such a broad term. And most people, especially if they're currently in kind of that pain and that kind of cloud that comes with it, like most people who think of exercise, they think I gotta go to the gym for an hour, I gotta get on the treadmill, I gotta
Sweat
do
a
all,
ton.
yeah, I have to spend money on it. I have to do this or that. And I think many providers, they don't know how to nuance it per patient, and that's totally fine. And my advice for that is to refer them to a therapist who treats chronic pain, because it is going to be completely different for everyone. And if someone is really, really pushing themselves through an exercise that's not appropriate, it's not going to help their pain. And then they're going to learn that exercise hurts me, and then being told to go and exercise again and again feels so disempowering, rather than giving them a tool that they can use.
Right. Or maybe not even like the physical pain they get from the exercise, like just that
Mm-hmm.
little piece of it. Like, I think there's a component of exercise that's about pleasure and joy,
Mm-hmm.
and- but also incorporating some of those parasympathetic techniques, the
Yeah.
breathing. I mean, it's also interconnected. So to me, it's exercise just means movement, but I like the idea of meaningful movement and moving with intention.
Yeah. And so ideally for me with my patients, like 9 times out of 10, when they're reporting a flare to me, I'm like, okay, good information. Your body is talking to us. Let's start with breathing. And then if you feel at all able, just go for a walk. A 10-minute walk for many people is very approachable and easy. I don't want it to be hard. I don't want it to be strenuous. I just want you to get your heart rate up maybe 10 beats per minute above its average. And then see how you feel. And if you feel better, that's a really good sign you might be on your way out. And if you feel worse, that's just information for us. I also, if walking is not really a great option for people, will send my patients a lot of very easy, gentle yoga videos. Um, because, like you said, options are great. So you don't have to do something you don't like, and you can start with something so simple. If my patients are like, I can't get away for 10 minutes, I'm like, great, let's do 5. Is 5 reasonable? It doesn't have to be this big chunk of energy time, and you don't have to spend any money. We just have to get the body, again, to kind of connect with itself. And movement is a great way to do that. And focusing on your breath with any movement is going to help it be even better. But again, oftentimes, most of my patients, I say, let's just start with the breathing. You don't even have to leave your chair. You can just focus on how you're breathing, where you may be holding, do some calming or mindfulness activities. And that is movement too. The breathing, especially as we get into kind of more options and more things, I kind of talk to my patients about it like this is like stretching from the inside. So a lot of times that like deep, deep pain, it can feel like, oh, I can't stretch, I can't move, I can't get to it. But oftentimes with our breathing, if we can kind of just like mindfully locate it and continue to breathe, we actually can start to let go of at least that sensation and that experience, right? Because we might not even really be tight, we might just feel tight. And those are two different things, and that's okay. It doesn't mean you lied about how you're feeling. Because sometimes patients feel very defensive of like, well, I am feeling pain. I'm like, I believe you. That's a given. I'm just trying to give you as many tools to kind of approach it as possible. And again, just the breathing, just the walking, yoga, playing with your dog is a great way to move. Playing with your kids is a great way to move. I always tell my patients, if you feel better instead of worse at the end, I'm for it. That's really the only goal.
Right. And I have patients who love just doing, like, maybe they like walking, but not outside. I have a lot of
Mm-hmm.
patients that love walking in the water because
Yes.
there's something very calming about feeling the water and having less gravity pulling down on their bodies. I
Mm-hmm.
have patients who hate the water. I'm like, then cool, let's stay out of the water. Let's find something else you enjoy. I've had patients who love Tai Chi, and have
Mm-hmm.
found different groups that have chronic pain that are doing Tai Chi in parks or in buildings. And some people, and they can modify to do it in the chairs. So there's all these
Mm-hmm.
wonderful, like, modifications that can be approached. And I think, as you mentioned, like there is a lot of like judgment that can come, I think, internally, because we want to be out there and we want to be doing everything like everyone else, right? Like we all just want to fit in. That's part of being a human. But recognizing that there are groups out there or things you can do that lack that feeling of I have to live up to some expectation to be able to be doing this right. Well, you know what? It's doing it right for you. And when you do it right for you, that's the best anyone can do.
Yeah, absolutely. And the factor of enjoying it is so good for your nervous system too. So even just on another level, I mean, laughter, like truly is one of the best medicines. It helps us vagus nerve stimulation, breathing, like everything. So if you like it and it's fun and you're moving, like that's what I want you to do more of, not killing yourself in the gym, not even close.
I have a patient who took up like salsa dancing
Yeah.
because it's not like really intensive, but it does give some like kind of fluid movements. And they really, really love it. So it's all about kind of seeking out what movement is joyful for you, and that over time you can pace yourself into doing more and more, knowing that you might get to a level of fitness and then have a flare and that decreases again. But you know what? You'll get back there. Just got to pace yourself.
Yeah. Which is common also with anyone who's doing new movement. So I think it's also helpful for humans, especially patients, to know anything novel for our brain and body usually results in soreness. So moving more may result in soreness, but that may be different than your pain. And that is still very much a step in the right direction, in my opinion. And so for patients too, it also gives them new experiences that are helpful for that desensitization of the central nervous system, where all discomfort is not bad. And it doesn't mean something bad is happening to your body or that it won't get better. It just means you danced really hard yesterday and you'll probably feel better tomorrow. You might need some more water and some more sleep. We can do those things. And so the gentle exposure is really, really good for the long term.
I always call that kind of that soreness you get with that all of us get, right? Like I'm picking up running again, you know, and I went out there and I pushed it a little hard, and boy, are my hamstrings paying for it today. But I call it the good hurt. I know that sounds like a little silly and a little, maybe, I don't know, cliche, but I can separate that good hurt because I can link it to what I did and know that I didn't hurt myself and it's getting better over time, to like a bad hurt, which is something we do need to pay attention to.
And so it's kind of like, at the end of the day, if we're going to hurt from doing things we love and have kind of that good hurt, or we're going to hurt from staying away from those things and kind of counting ourselves out already because we have pain, like if that's our less than perfect option, like which would you prefer? And most people, when they sit down and frame it that way, are like, I would rather have soreness from having fun than pain from excluding myself from activities because I have chronic pain and I can't do that. And again, I don't want anyone to push through pain or do something that makes them feel significantly worse. But if you're more sore than your friends after like going for a long walk with them, you just might need more resources to recover. And again, like we can do that.
And that's something I've been talking a lot with my patients about. You know, it's like a thing you can tack on to just about anything related to life. But I think it makes a lot of sense in the pain space because it's actually okay to have a flare. It doesn't mean you did something wrong. Like it's normal process for someone with central sensitization. So I think having that mantra of like, and it's okay, is a really lovely thing to kind of put in your vernacular. Not just for any human, but I think especially for a person with fibromyalgia, because I think that concept of grace, no matter what the situation, whether it's a good day or a bad day, is just a really important thing to hold in your heart.
I wanted to come back briefly just to central sensitization, which is kind of where we started. And, you know, we talked about how breathing really affects our central nervous system, our parasympathetic and sympathetic nervous systems. Just wondering, when we talk about movement, why does that help with central sensitization?
Oh my goodness, so many reasons. uh,
Well, since you are a doctorate of physical therapy and kinesiology, go ahead and answer this question.
I'll jump in, but I would love for you to add your thoughts as well. I would say the simplest answer is that so many of our body's functions rely on the movement of our body to function at their best, right? So, something specifically with the breathing, we know the changes in our breathing naturally responds to movement. So that is really helpful. If you're someone that you're like, people keep saying to diaphragmatically breathe, and I can't do it. Like it's a struggle for me. Getting your heart rate up and getting to where your body is doing it on its own helps so much. It gets your blood pumping, which gets more blood to our limbs once we intentionally switch into that sympathetic mode, which again, not a bad place to be. We just don't want to get stuck there. That gets more blood flow to our limbs. Our lymphatic system is so important for inflammation management and just chronic illness in general, and our immune system to be able to fight things. And if we're sedentary, so is our lymph. It doesn't have its own pump like our heart, or peristalsis like we see in our digestive system. It responds to movement, and just getting that lymph moving can help. This is so popular now, like massaging your face to help with that puffy look. It's the same thing for the rest of our body. A lot of my pelvic pain patients end up with a lot of lymphatic congestion in their pelvis. And you can do all sorts of massage techniques, and that does help with that. But the simplest solution is to go for a walk and just move your body. And then we also know just after we exercise, that cortisol comes up, but then it also goes back down. And again, it's supposed to rise during exercise, but we can kind of complete like the stress cycle and get to the other side where we are more naturally parasympathetic. And when we're less sympathetic and more parasympathetic, we're also less sensitive to pain. And so you still might have pain, you're just less sensitive to it. Again, the reasons go on and on. Like our bodies, I tell all of my patients, like our bodies need food, water, rest, and movement. Like it really is up there with those top three that we tend to focus on. For general health in every way, cardiac, lymphatic, musculoskeletal, all of it. And then it helps us get stronger so that the more we need to do in life, the more ready we are to respond to all of that. And then that's not even talking about just like the mental health benefits, which are huge for central sensitization. But we know that like it's one of the most reliable treatments for a lot of anxiety and depression is just moving first. You might need more interventions and more help, and that is great. And if we're not moving, we don't really have a fighting chance against those oftentimes. And so I would love anything you want to add. I don't want to get too sciencey.
Oh, I mean, there's a lot of science we could go into.
Yeah.
I think I'll just kind of like touch base with like a very broad overview that our brain has the ability to control pain within itself, and it's called endogenous pain modulation. And oftentimes in persons with central sensitization, that ability for the brain to tap into its natural function becomes less. And it's oftentimes related to neurotransmitter imbalances, things like serotonin, dopamine, norepinephrine. And so outside of your drug classes that can help boost that, one of the other things we can do beautifully to improve those neurotransmitters in our brain is move and sleep. So again, if you want to think about, take the word exercise out of your brain, but put the word movement up there with eating, sleeping, breathing, it is a higher executive function that our body desires and needs to maintain homeostasis. So really, movement, again, whatever that looks like for a person, is necessary for our body to function properly. And so it's about finding that right balance, what makes you happy, again, the mental benefits of it. I know I feel really great when I can be having a horrible day, right? I had a bad day or, got some bad news. A walk can help me feel better because I'm moving, but it also helps me kind of clear my mind. So it is that mind-body connection when it comes to movement. And again, take the word exercise out of the brain and think of movement as good for your body and your soul.
Mm-hmm. Yeah.
Thank you so much. I appreciate you connecting the dots there and bringing it back to where we started. And for my last question, I just wanted to wrap things up. If people are seeing a physical therapist for the first time, Dr. Maguire, I'm just curious about, especially with fibromyalgia or chronic pain, are there any questions that patients can ask their physical therapist, or things that they should, know going in?
Yeah, I always recommend, like, most physical therapists are trained as generalists. And so that's kind of the way our education works. So most of us have been trained in a little bit of everything. And then we have the opportunity to specialize once we start practicing. And there's a ton of different avenues of that. So especially if you have like chronic pain, or maybe you specifically are wanting help with TMJ or pelvic pain or something like that, I would recommend finding someone who specializes in that area, which probably isn't going to just be whoever's closest to your home address. It might be, which is great. Um, and so you can call around and ask if anybody knows or recommends a specialist in TMJ or pelvic pain or whatever. And then, especially if you know you have fibromyalgia or struggle with chronic pain in general, I would follow up and ask, do you have anyone who really loves treating chronic pain? Because hopefully by the end of this like talk, you can tell, like, I love it. I love helping these people, and there's so many resources available, but you do need to go and learn about them. And so I would seek out someone who wants to treat what you have, and you're probably going to get the best results with that person for a variety of reasons. There's also a ton of registries that a lot of us are on, where we kind of go and self-identify. So if you search my name on really any pelvic health specialist, I'll come up. It'll tell you, I practice at Genesis PT and Wellness in Fort Worth. I also offer virtual. So those are great databases to find too, and kind of seek out who might be the best fit for you. That's also realistic for you to go see in person or virtually. I always recommend in person. I say it's kind of the gold standard, especially for PT, but sometimes it's not feasible. So I do see a lot of patients virtually that live, like, in rural Idaho, like they don't have anybody nearby they could go see for their pelvic pain. So there is a broad availability within pelvic, not even specifically pelvic health, but PT in general, of people who can help with all of these things. And again, you'll hopefully find someone who is happy and willing to treat all of your pain as part of resolving a specific pain. So I also wouldn't limit yourself to, like, I need to see a TMJ specialist, I need to see a pelvic health specialist. Your provider should be willing to connect you with someone else if you need to be referred out. So the kind of main questions I would ask is just like, do you specialize in this pain, and do you love treating chronic pain? Because that's what I'm here for, and that's what I have. And find the person who's excited to help you.
Thank you so much. And just to close out, wondering if you could both talk a little bit, Dr. Maguire, you mentioned it a little bit, but just to wrap up with where people can find you and what you're working on.
So I'll just kind of pick up where I left off. I practice at Genesis PT and Wellness at our Fort Worth location. We do have quite a few locations across the DFW area. We specialize in pelvic health, and we treat chronic pain in general, and a lot of us love it. So if you are in DFW, you could just come see us here at Genesis. And then, like I said, we have virtual resources for patients who don't have anything nearby.
I am at the University of Kansas School of Medicine. I see patients through my clinic there. And for patients who are in the state of Texas looking for fibromyalgia care, swing care is an option in that state, and soon to be other states as well, for accessing that fibromyalgia focused virtual care.
Thank you so much. This was such a great conversation. I feel like we covered, everything from breath to movement, and really understanding why we often hear that, exercise word, but we're calling it movement now, out of your brain exercise. So I just really appreciate learning more about why we hear that and why it can be really effective for fibromyalgia, as well as, some things we can start doing today. So thank you both so much for being here, and look forward to the next conversation.
Thank you.